Hello, my name is Ashley Baker, and today I'm going to be performing an intramuscular injection with the Z-Track method. So I did go ahead and check my order, and I do have an order for vitamin K, 1 milligram per 1 milliliter intramuscular, and it is just one singular dose. So I have checked my 5 rights, so right client, right drug, right dose, right route, and right time. And I did assess for allergies as well. So I'm moving my patient out of the way. My patient is leaking a little bit, so I will swap patients at the moment in time. And so now I'm going to grab my vitamin K, and we're going to pretend that there is not accidentally medication left on the counter. I would use a sanitizing wipe for that, but for demonstration purposes, I do not have one of those, so my hands will just be yellow. So I do have my vitamin K, and I do have an order for 1 milligram, so I have my 3 mil for 1 milliliter, so I do have my 1 milliliter syringe. And I'm going to grab my needle and place it on my needle, place it down. Now I'm going to clean the top of my vial. And I'm going to draw up the 1 milliliter that is ordered for air. And I do have my 1 milliliter, removing my cap and placing it in, pushing the air in, and flipping it upside down to draw the dose out. My 1 milliliter. And flip it back down, remove it, and get the air bubbles out. So I do have my 1 milliliter ordered, my 1 milligram per milliliter, and this was already reconstituted, which is why I did not do it in the video. So I will remove this needle and discard in the sharps container, but for demonstration purposes, we're going to keep it right there. I'm going to grab my other needle. This one's 1.5 inch. Place my needle on. So now I will go into my patient's room. And I did check the 5 rights again, and I did assess for any allergies. Going to assess the skin, and this is an intramuscular injection with the Z-Track, so I will be performing that. So I will apply my gloves, which I would have done in the med room as well. But for demonstration purposes, this is the only pair available. So I just have them here so that you know that I'm going to be using them. So in my patient's room, hand hygiene and apply my gloves. I assess the skin. Now I'm going to clean the skin in a circular motion, working my way out. Do not blow or fan my skin. Allow it to air dry. Just checking my medication again, and it is the 1 milliliter ordered, and I had reconstituted it earlier. My skin is almost dry. And of course, I would never place it around lesions or rashes or anything like that. So now that my patient's skin is dry, with the Z-Track in a normal person, I would displace the skin backwards with my fingers, but just for demonstration purposes, I will be pulling back just like this. So I'm going to remove my cap. Displace the skin, and we're going in at 90 degrees, going slow. And this is used especially in medications that have a dye in them. That way the medicine does not come back to the top. Remove and displace the skin back to where it came from. And I would activate the safety cap and place it in the sharps container, but for demonstration purposes, I will be just applying the cap right back to it and discarding. And then I would use my cotton ball to blot any bleeding, and there was no bleeding noted, so I will remove my gloves and perform hand hygiene and check on my patient in a little bit.